Thank you to newlyweds Sarah and Quentin for sharing your story. And thank you, Dr. Julie Halle and Dr. Michael Solon, for those excellent presentations. One of the biggest changes in neuroendocrine cancer has been the expansion of treatment options. While this progress has created new opportunities and hope, it has also made the treatment landscape significantly more complex to navigate. Dr. Hendifar, patients today may hear about somatostatin analogs, chemotherapy, PRRT, targeted therapies, liver-directed therapies, and clinical trials, to name a few, sometimes all within a single appointment. How do clinicians approach navigating this growing number of options?
Yeah, the treatment landscape is very large, growing and expanding. So many options, so many different ways to approach a particular problem, a particular patient's clinical situation. I think one of the ways is what we've been talking about is getting the neuroendocrine tumor team involved to help whittle down which options make the most sense for a patient. But I think that another not well recognized is that doctors are starting to come up with principles of neuroendocrine tumor care. For example, if the patient is going to outlive the tumor, maybe they don't need treatment. For example, how much disease does the patient have? What is their tumor burden? Is it high or is it quite low? Another important characteristic of the patient that can bear on which treatment to choose is whether or not the disease is confined to the liver, what we call hepatic predominant or extrahepatic. And these help us sequence and approach patients, even though they're unique, in some kind of algorithm that's more generalizable. But I think in general, we try to, we're developing these principles as time goes on. There's a lot more consensus today on how we should approach particular problems than used to be in the past. And I think that's because we do a pretty good job of talking to our colleagues and getting team members involved in everyone's care.
Yeah, getting involved and really finding that way to have common ground and consensus. Mary, I think many patients struggle with that feeling that they need to become experts almost overnight. How can patients approach treatment discussions in a way that feels informed without also feeling overwhelmed?
Yeah, as we've mentioned, overwhelm was so common at the beginning, and it's really challenging to become an expert on net. It is complicated. And everybody manages this differently. There are people that immerse themselves in education, and there are people that are completely paralyzed by their diagnosis. And this is when I say all approaches are okay. Everybody's going to do this differently. And wherever you fall on the spectrum, it's just important to be educated. And if it's not you, is have a caregiver that's able to support you in this at a comfortable pace and still be present in your life, still be with your loved ones, separate from this life with cancer. It can envelop you and your life is still going on every other aspect. So I would strongly recommend living your life with your loved ones and not just concentrating on the cancer if you can help yourself do that. And then a practical piece of advice I would give is the overwhelm comes a lot of times from feeling as though you have so much to talk to your doctor about. And I would say taking notes on symptoms, on feelings, on questions you have while you're waiting for your appointments as they come up in your life is so important. So you feel organized, and sometimes just writing them down kind of calms you a little bit. And then even submitting them through your portal to your doctor prior to getting to the appointment so that your doctor is able to see what your concerns are before you come in can be really helpful for both of you. So those would be my practical pieces.
Yeah, organization and communication. Dr. Hendifar, one of the realities is that patients really worry about making a right or wrong decision. They want to make the best decision. How do you help patients navigate uncertainty when they worry about this and maybe there are multiple reasonable approaches?
Yeah, this happens every day in the clinic. You have multiple good options and you're trying to figure out which is the best one for the patient in front of you. And the way I navigate it is I make sure that we go into a detailed risk benefit of each of the options. And then we kind of go into the patient themselves. Where are they in their life? What's going on with them for the next year or two? Are they working full time? Are they planning big travel? And then, it's kind of tough, but I think it's really important that the patients weigh in at this point and saying, okay, since these are all reasonable options, this probably based on this discussion, this option's best for me. And play off the physician and go back and forth and try to figure that out. It's really tough if the physician just gives you options and makes you decide on your own. So I think it's important a dialogue, just a discussion, maybe asking your doctor a bunch of questions about, okay, so how am I going to feel on this treatment? How is it going to affect the other things that are going on in my life right now? And try to, develop the dialogue a little bit more between the doctor and the patient.
Yeah, that dialogue is key. Again, communication. We're excited to introduce our final set of speakers.
Our next presentation is Navigating SSAs and Chemotherapy by Dr. Guillaume Will Pena, medical oncologist at Oregon Health and Science University, Knight Cancer Institute in Portland, Oregon. Following that, we'll hear Navigating Targeted Therapies and PRRT presented by Dr. Jennifer Chan, Clinical Director of the Gastrointestinal Cancer Center and Director of the Neuroendocrine Tumor Program at Dana-Farber Cancer Institute in Boston.
And then next after that is Navigating Clinical Trials, presented by Dr. Thor Hefdonerson, medical oncologist at the Mayo Clinic in Rochester, Minnesota.
Then we'll be hearing Navigating Treatment Sequencing from Dr. Pamela Coons, Professor of Internal Medicine and Director of the Center of Gastrointestinal Cancers at Smilow Cancer Hospital and Yale Cancer Center.
And then we have a presentation, Navigating Treatment Side Effects, with Dr. Jason Starr, who is a medical oncologist at the Mayo Clinic in Jacksonville, Florida.
We'll then transition into our second panel discussion, Navigating Treatment Decisions. This panel will be moderated by Dr. Heidi Del Riviero, who is both a medical oncologist and endocrinologist at the National Cancer Institute at the NIH in Bethesda, Maryland. She'll be joined by Dr. Chandrika Chandrasekaran, a medical oncologist at MD Anderson Cancer Center, Dr. Calissa Clark, Division Chief of Surgical Oncology at Froedtert Hospital and the Medical College of Wisconsin, and Dr. Eric Mitra, nuclear medicine physician at Oregon Health and Science University.
And finally, we're going to close with another patient story, and this one's reflecting on the lived experience and navigating the treatment decisions while living with neuroendocrine cancer.